All right. Hello and welcome everyone to our Partners in Health webinar. I'm happy today to be here with Dr. Beppe Raviola, who I'll introduce in just one moment. But first there's a little bit of housekeeping just so that everyone online knows how this all goes. I'm sure many of us are used to Zoom now, but for those who aren't, I want to give a little talk through. So today's topic, it's the first in a series of webinars that Partners in Health is doing. And this one is titled Mental Health in the Time of COVID-19. We'll dive in shortly, and Beppe will give us a presentation here. He'll be sharing his screen today. But as you get used to your Zoom here and people get online with us here, I'd like to take you through some of the best options here. So at the top of the screen, you'll see view options. And we thought it would be best if everyone, the best experience is if you click the side-by-side option. That way you can see the full presentation, and then there's a lineup of videos along the side for whoever is speaking at the time. You'll also notice that there's a bar in between the presentation and the videos of the speakers. You can move that to the right or left in order to adjust the size of the presentation if you're having troubles viewing and reading as Beppe is going along. So one more little reminder too, we will be taking questions at the second half here. Beppe will be speaking for about 20 to 25 minutes. We have pre-submitted questions, which have really been great from the audience, but we also want to welcome people to ask questions as well. So if you see at the bottom of the screen, there's a Q&A section, so you can just place your question there, and we'll line it up for Beppe as well. Also feel free to chat amongst yourselves in the chat option. All right, and with further ado, welcome Beppe. Thank you for joining us today. I'm really looking forward to this conversation. And I want to tell everyone who you are. So at Partners in Health, at least you're the Director of Mental Health, but you have multiple titles as well. You are the Director of the Program in Global Mental Health and Social Medicine and an Assistant Professor of Psychiatry at Massachusetts General Hospital. You're Associate Director of the Chester M. Pierce MD Global Psychiatry Division, Director of Mental Health at Partners in Health. And at Harvard Medical School, you're the Assistant Professor of Psychiatry and of Global Health and Social Medicine. I hope I got everything in there, but correct me if I'm wrong, Beppe. And again, welcome.
Thank you. Can you hear me okay?
I can hear you great, yeah. So I think maybe what we'll do here is have you go through your slides, and you have control, so take it away, and then I'll jump in towards the end of the presentation. We can continue with our questions.
Great. Hi, everyone. Thank you for joining. I'm going to try to give in 20 minutes a scoping review of what we've been thinking about with regard to mental health in the time of COVID-19. I am a clinician. I'm a child and adolescent psychiatrist, so I'm going to start more on the personal wellness clinical side, and then I'll move more towards the global health side with Partners in Health. And it's a real privilege to be speaking with you. I'm going to talk about the current moment, the sense of urgency and rapid social change that we're all living through. I'm going to talk about the idea of self-care and provide some information about that. And I'm new to this too, so people's ideas are really welcome. And you know, this is obviously an unusual situation for all of us, including mental health practitioners. I'm going to speak to the Massachusetts mental health and psychosocial response, and I'm going to speak to the PIH global mental health and psychosocial response across our 10 sites. So I'll go from self-care to locally here in Massachusetts and the US, then globally PIH. And then I'll close with a couple comments about global mental health delivery in the world and how it might be shaped by this situation. So we're living in a moment of rapidly escalating urgency and social change, and we're all kind of on a roller coaster here. This is a really captivating visual that I think captures some of the near and long-term challenges related to COVID generally, and also with regard to the evolution of chronic disease and mental health. You can see in the green, there's a first wave of immediate mortality and morbidity of COVID-19. And we're really, at least in Massachusetts, we're right there at the top of that wave. You can see there's a tail for that wave in terms of post-ICU recovery and some of the challenges we've been reading about in the newspaper. Also some of the neuropsychiatric complications of COVID, which people are trying to understand better. There's a second wave related to the impact of resource restriction on urgent non-COVID conditions. And this past week, the governor of Massachusetts was urging people not to avoid going to the emergency room, for example, for other kinds of conditions. There's a third wave of interrupted care on chronic conditions because of the burden on the hospitals and outpatient clinics and people avoiding the hospital as well. And then there's a fourth wave of psychic trauma, mental illness, and the downstream effects of economic injury and burnout. And I want to speak to that as well. We haven't lived through many pandemics here in the US, but there is some knowledge of the psychology of pandemics. And there's an interesting mirroring of the epidemiological process, that bump that we've all been following, in the realm of psychology. And there's also this issue that both infectious diseases and mental health conditions are highly stigmatized. And so there's this concept of infectious disease as an actual contagion and mental illness as a symbolic contagion. And all of the stigma and isolation that we see with each of these independently, and all of the fear that accompanies it, each of these phenomena, and then when we put them together, it really has an effect on the popular psychology. And then fear, desperation, and anger are normal reactions at this point, and these are unconscious, biologically rooted reactions. And then we're also all confronted with this search for deeper existential meaning, with this disruption of reality and order, and the connection of this existential questioning to our own spirituality and religiosity as well, which is all very relevant. This was an interesting piece, which I thought captured it. And we're going to make these slides available. We'll follow up and I'll send out the slide deck. So there are these hyperlinks that you can find. But there was a nice piece by Mark Lipsitch and Jonathan Grad, an old classmate of mine from medical school, really describing us as being on a small boat far, far from shore and trying to get to shore. And so psychologically, I think that there is a parallel process, and this particular article captured it quite well. We're clambering into a life raft, and dry land still feels far away for all of us. And so we are all experiencing a range of emotions every day, a growing sense of foreboding, grief, and loss. For others, possibly ourselves, our family, friends, and colleagues, there's this sense of powerlessness and loss of control, and this growing uncertainty about the future. Something like acute on chronic uncertainty, because it seemed even prior to this that we were living with a certain amount of uncertainty in our political lives, and just the way people were thinking about the fast pace of social change as well. But there's also this hopefulness that positive change can come out of this crisis, and we're hearing a lot of gratitude as well, and people contemplating the meaning of their lives, how they spend their time, who they spend their time with, and what they're doing. However, we're all apparently adapting to this new reality of a pandemic future. And so we're confronted with various aspects of pandemic mental health response, the issue of quarantine as a necessary public health intervention, which can have its own downstream effects on mental health. Of course, there's the issue of mental health burden on health workers, both the risk of infection, psychological trauma, and this concept of moral distress. And there was this tragic loss of a wonderful emergency room physician in New York City over the past several days. So these events and tragedies awaken us to all of the complexities of this situation. And then, as I mentioned, there seems to be a lot happening in the neuropsychiatric aspects of COVID and how it affects the brain. And so we therefore need to anticipate a wide range of mental health and psychosocial needs: psychosocial, grief, trauma, stigma, disability, in the short and long term for survivors, families, and healthcare providers. Just to emphasize that common reactions that people are experiencing, that you and I are experiencing, are normal. The fears of falling ill and dying, feeling anxious, distracted, and worried, and I'm going to touch on that and how that is affecting kids as well and their ability to do their schoolwork. The avoidance of approaching health facilities, fear of losing livelihoods, losing work, being socially excluded, being placed in quarantine, feeling powerless to protect loved ones, fear of being separated from loved ones and being separated from loved ones, which is a very difficult situation for many, fear of being refused care, feelings of helplessness, boredom, loneliness, depression due to being isolated, all normal. And for example, for some of our colleagues in West Africa who experienced the Ebola crisis of 2013 to 15, fear of reliving the experience of a previous epidemic as well. And then there's also household and community effects that we have to pay attention to: the potential increase in child abuse, domestic or intimate partner violence, substance use, the anxiety related to long-term economic hardship and loss of social networks. And this is really important, that while stress affects everyone, and not all stress is bad, and acute stress can be very adaptive, and that's deeply ingrained in our biology, that in dangerous situations, stress signals the body to prepare to face a threat or flee to safety, the fight or flight response, that long-term stress can harm our health. And those same life-saving reactions in the body can disturb the endocrine, immune, the peripheral nervous system, cardiovascular, sleep, reproductive systems. And people experience stomach upset, headaches, backache, sleeplessness, irritability, all of these things. But then over time, the elevated levels of cortisol and stress hormones in the body really can break down the body and muscle, bone density. There's all kinds of processes that promote heart disease, high blood pressure, diabetes, other illness, and then comorbid depression, anxiety. All of this has huge implications for chronic illness and for our health systems as well. And I'll just direct you to, there's good resources at NIMH in terms of learning to manage stress and accessing resources, but I'll say more about that. For some of us, this hasn't necessarily been a new situation with regard, for example, to healthcare workers. Back in 2000, 20 years ago, I worked at the largest public hospital in East Africa, and with a team from Harvard, we completed the first study in sub-Saharan Africa looking at physician mental health in public practice in the context of HIV, working without antiretroviral medications. And at that time, we identified this moral distress that the entire profession was facing. And the findings of that work really pointed to the importance of structural interventions. Not, yes, psychotherapy is important and mental health care is important, but we really have to look at social determinants and other structural determinants of the problem, such as obviously the lack of PPE for providers when we think about mental health. And there's been a lot written in the press lately about the mental health of healthcare workers. So we've got to take a multi-pronged approach to these kinds of issues. There's a nice article that a colleague of mine, Melissa Abraham and Rachel Smith, wrote. It just came out yesterday, I think, and it's guidance for psychotherapists in working with healthcare providers knowledgeably and compassionately around the issue of moral distress. There's no diagnosis of moral distress, but moral distress is a real phenomenon that certainly healthcare providers are facing, but many other people in many other professions may be facing. I'm thinking about school teachers with regard to moral distress, having to manage their own families, and then be expected to, sit and manage and support children long distance, which is something they've never been prepared to do. So I found this guidance from Melissa and Rachel really excellent. Trying not to fix moral distress, recognizing things early, being cautious about diagnosing people with depression, for example, using what you know, compassion, being eclectic in your approach, avoiding saying, I know how you feel, making room for non-COVID related experiences as well. And this is one of the things that we're all going to get flooded with only COVID information. And that leaves a situation where we have less attention to other things. And then pursuing the purpose, pursuing purpose and meaning. Jim Kim wrote a very nice article in the New Yorker on the need to go on offense with this 5-pronged approach to COVID: social distancing, contact tracing, testing, isolation, and treatment. I'll just leave it at that, but that is our 5-pronged armamentarium to address COVID. And we're really thinking about the psychological aspects of the social distancing and the contact tracing in my talk here. In terms of self-care, there's very nice guidance from the Interagency Standing Committee, which is it's a branch of the UN essentially that helps to organize emergency response in humanitarian crises. And I do think we're in a humanitarian crisis here in the US. And there's this very nice triangle, and the emphasis of this triangle is to help us, to remind all of us who are responding to really focus on the bottom of the triangle first: basic services, social considerations, safety, security, reestablishing social networks, strengthening community and family supports, creating child-friendly spaces, utilizing communal traditional supports, and then moving towards basic mental health care by primary care physicians, basic emotional and practical support, and then moving towards specialized services, just to emphasize that some of the questions that we got for this session related to peer support and non-clinical support, and that is what we need to focus on, and taking a wellness approach, as well as strengthening health systems so that they can meet all of the needs around more significant and moderate to severe presentations of mental health concerns. I'll just refer you to 10 practices that I wrote about that are on the PIH website related to self-care. And I wrote this with people I work with clinically, some of whom might be on this Zoom session. And, I've been learning more, thinking about social distancing and using technology. Video is very helpful. Scheduling appointments for your kids to have video dates with their friends rather than sort of leaving it. Being proactive about those kinds of things, because the tendency can be to not do that. Having clear routines and schedule, not going overboard. I have people who they feel guilty because they can't follow the schedule. Kids with executive functioning issues, inattentive type ADHD, it's particularly difficult, but for some of them, they're really stepping up and they're holding to a schedule in a way that they didn't before. And I can see a clear difference in the mental health and how people are responding when they're holding to a schedule, number 2, and then they're also, number 3, exercising if it's possible, and resetting. Exercise, cardiovascular exercise is one thing. It's another thing to reset and go outside, for example, within the bounds of what's allowed, or just number 4, shifting your brain in a different way, in intellectual engagement and learning, using your brain in a different way. And then 5, working to counter negativity in the household, having an extra long fuse, being extra patient, really trying not to be reactive, but using that reactivity as a signal that we need to do some more self-care. And then remember not to isolate too much. If you can meditate or use focused relaxation techniques, spirituality, religious practices, very good. Do the things you enjoy if you can do them. Find a way to do them. Limit exposure to the news. Find ways to cleanse yourself of it, for example, before bed. And then something that people have really been responding well to is bathing daily, if possible, to reinforce a feeling of cleanliness. People have been using bathing as a really meditative moment. And some other things I've been working on with folks is to really not go catastrophic. The world is not ending. It feels that way, but it is not. Most people are good. People are going to persevere and help each other. I think altruism and helping other people is a very important self-care intervention for oneself. It may be one of the most powerful. Reminding yourself you're tough and you've overcome challenges before, and this is a new one. It's a strange situation. Let's have a sense of humor here and there. And then if you are sort of tipping into an obsessive compulsive space, reminding yourself that the mind does play tricks on us. These are biological cycles that our brain can kind of kick into, and we can kick our brain out of it. And so one ritual, for example, if there's a lot of hand washing, is to go to the sink, remind yourself that your brain is playing a trick on you while washing your hands, and then separating and moving that internal discussion on. And then not thinking too far into the future, which is really difficult. I'm worried about the next wave of information kids are going to be getting relating to summer camps. And I think kids have been tolerating the situation. But over the next couple of weeks, I know that colleges are now sharing information on what they're going to do. And so we do need to be concerned about preventing depression and really being proactive about wellness approaches. There were some questions about mindfulness and COVID. There's nothing in the literature yet, but I've got some references here. And again, we're going to share this presentation. But there is some very interesting literature on mindfulness. For example, mindfulness meditation, activating altruism, and quite good evidence for mindfulness. And people find all kinds of different ways. And then there's apps such as Calm, Headspace, 10% Happier, Waking Up, and there's books as well. So these are all things that people can refer to in trying to develop an intentional wellness practice that may include that mindfulness. There are some great resources from MGH on self-care and resilience. There's an MGH guide to mental health resources. We'll share that link with you. The Benson Henry Mind-Body Institute at MGH has developed a 3-session training on building resiliency in difficult times. We've been sharing that with our contact tracers. And there's another set of resources, another 3-session resilience training for healthcare workers. And then there's a very nice video series, a 4-session Vimeo on building resiliency in the face of pandemic. So you can access all of these readily. And then I think it's essential that people just have access to basic information. There's a Massachusetts 211 hotline, which is all about COVID, and there are links to access mental health support that the state is supporting and financing, and supporting Riverside Behavioral Health to support that work, which is a remarkable thing. And then for more serious mental health concerns, MBHP has an emergency services hotline. It's a behavioral health crisis assessment line. And there's a hotline, and there's also local resources. And you can find MBHP ESP. And there's some other resources from Massachusetts. There's also resources from SAMHSA. And this is all, you can actually reach somebody on the phone and get support, and you can refer people to these resources for support. And then there are hotlines for interpersonal violence, child abuse, elder abuse and neglect, abuse or neglect of a person with a disability, and substance use helpline. And these are all really important numbers to have as well, because these are concerns that we're going to continue to have as the situation evolves. With regard to people living with pre-existing mental health problems, there's some things that they can do. Proactive outreach to their providers or to new providers, proactive medication management and anticipating supply chain or access issues, safety planning, proactive video appointments with friends, family, and other social supports, proactive addressing of basic needs, home delivery, other ways to alleviate stress. I think that accessing shopping and all of that is incredibly stressful for people. clear information about the situation, developing clear lists of coping strategies that are individualized, and seeking peer support from others with lived experience as well. And I'll just direct you to NAMI has some nice peer support resources and guidance, and you can contact me if you have more questions about that. And then for people living in particular isolation, really alone by themselves, maintaining social networks while self-isolating through the phone and social media, keeping personal daily routines and a schedule with frequent resets, as I was describing, trying to pay attention to your own needs and feelings. Don't hesitate to seek remote counseling or peer support groups. Cardiovascular exercise, if possible, can be protective, the endorphins. Identifying healthy activities that you enjoy and find relaxing. And then using your own expertise, experience, and strengths to contribute to supporting your community. Checking on neighbors, providing peer support, recording instructional videos. There's all kinds of activities that you can engage in that could be very beneficial. And then here's some guidance for healthcare workers to think about what's helped you cope in the past, taking time to eat, rest, relax, even for short periods, keeping to reasonable work hours, easy enough to say that, of course, regular rest periods, acknowledging your personal and professional limits, understanding that every action may not result in a positive outcome, minimizing alcohol, caffeine, or nicotine intake, avoiding non-prescription drugs, checking in with colleagues, peer support, finding ways to support each other, and of course, talking with friends, loved ones, and other people you trust. And then for parents of children and adolescents, maintaining familiar routines in daily life, providing kids with age-appropriate information, remembering that kids observe adult behavior and emotions for cues on how to respond and calibrate their own emotions, and then really trying to find ways to make it safe to express and communicate feelings they might be having that are disturbing, and helping them find positive ways to express those feelings. Every child has their own way to express emotions. Playing, obviously, drawing can facilitate this process. Connect proactively with teachers, and then just anticipate and expect sadness, confusion, and behavioral changes, even though you might not be seeing them, and just assume that it's a difficult situation, even if they say it isn't or are putting on a good face. And every family has those kids who are the ones who put on a good face and never complain and take care of everyone, and finding ways to attend to those kids, as well as the ones who are obviously struggling. The MGH Clay Center has some very nice resources to help guide families and support kids through the pandemic. But again, reminder that prolonged anxiety is normal and it can affect cognitive functioning. I saw a nice article about this brain fog that is, it's a natural, it's related to anxiety and it's real. And so this expectation that you're supposed to operate at the top of your game, or that the kids are supposed to be thriving in school, we just have to keep in mind the ongoing stress. And then you have to keep in mind that remote learning is just not working for some kids. It absolutely is not for some. And, there's more coming out about Zoom drain, and this seems to be real. So here's some nice articles on that. And the other thing is the poor teachers who can't be all things to all people and who themselves are at risk of burnout. There's a nice article on teachers needing to always be on. So we just have to bear in mind what the teachers are going through. And at the same time, I would just say, don't underestimate the value of direct contact with other parents and teachers. And so I'm going to go quickly over our Massachusetts mental health response. You are familiar, I hope, with Partners in Health as a nonprofit social justice organization striving to make healthcare a human right for all, starting with those who need it most. And so we've seen some nice articles, this is from Ellen Barry of the New York Times, describing the situation in Chelsea. And so COVID really seems to be, taking advantage of communities where people are living in close quarters, communities where people are essential workers, migrant communities. And so there's a real importance to the contact tracing component of this effort to reach people in all places. And there was a piece on NPR where Joya Mukherjee was interviewed, and she talked about the need for varied and empathic support as a foundation for contact tracing, and the need to care for people when they're in distress, having somebody to listen to and help them navigate the really difficult time people are facing, when they have to go into quarantine, but others as well. So what we've done is we've integrated an initial mental health and psychosocial training of the contact tracers that includes a component on providing psychological first aid, effectively linking individuals and families to mental health care, supporting special populations, and promoting the self-care of the contact tracers as well. And I'm not going to get too much into psychological first aid, but psychological first aid is a tool. There's different curricula for psychological first aid, but the concepts are the same. Really, psychological first aid focuses on contact and engagement, ensuring the safety and comfort, and if needed, the stabilization of people in distress, providing information, gathering information on current needs and concerns of people, and providing people with practical assistance and information, basic information, and also information on coping, and then connecting people with social supports, and finally linking people with collaborative services. So there's a field operations guide from the National Child Traumatic Stress Network that is very robust and helpful. We also have been using the World Health Organization guide for field workers for psychological first aid, and we've broken down our training into 3 components: look, listen, and then link to services. And if you'd like to get trained in psychological first aid, because there were some questions about peer support, psychological first aid is not a clinical intervention. It's a set of basic practices to provide support to other people. And I'm providing you with both written curricula and field manuals, and also online certification courses that are pretty quick. And these are just really helpful skills to learn. And with the excellent contact tracers, we've also been thinking about special populations, people living in isolation, older adults, people living with disabilities, people living with substance use concerns, immigrants, migrants, and refugees, children and adolescents, and healthcare workers. All of these groups have been part of the discussion. In terms of the Partners in Health, mental health, and psychosocial response, over the past decade, we have created and built platforms for mental health service delivery, and these are now platforms for COVID-19, mental health, and psychosocial response. Our global mental health response has included using international guidance on evidence-based practices, response coordination, team development, undertaking essential needs assessments, training in communication and problem solving and psychological first aid, basic management of neuropsychiatric disorders, which is something that we had been doing in an ongoing way, essential use of medications and psychopharmacological interventions in the context of an emergency, and establishing appropriate lines of referral. There's a very nice briefing note from the Interagency Standing Committee. I mentioned it before, but I'm just giving you the cover here and the link to help you access it, because we're using that. And we have been working in collaboration with our 10 sites, taking advantage of clear communication channels with our mental health managers and clinical teams that we've established already over time. Weekly video and teleconferencing, WhatsApp groups, digital platforms, monthly learning collaborative meetings, and development of a cross-site tracker, and then aligning our mental health strategy with the overarching PIH response. And you can have a link here that gives you the broader information about the PIH global response. And our priorities have included limiting the spread of COVID, sustaining crucial ongoing mental health services, reducing the impact on those particularly vulnerable to mental health conditions, and then reducing the mental health suffering and improving functioning related to COVID as it arrives. And we've been using a Partners in Health cross-site mental health service delivery value chain that we developed. And I'm not going to stop too much here, but you can find this online. I'll show you the link. The value chain that we've developed over the past 4 or 5 years describes the system of care from the entry of the patient and the service user to exit. There's a health facility component, there's a community component, and it starts here on the left with this crisis response component. And this informs a service delivery planning matrix that we've used to plan and organize services with limited resources. And so we really buy into this idea of using the COVID situation to continue to build back better with health systems through the integration of mental health care. Our cross-site team engages in 4 core mental health activities: clinical supervision and mentorship, program and technical advisement and targeted research support, and development of quality improvement and data systems. And we have docking points at Harvard Medical School. We have several fellowships, and we have relationships with the departments of psychiatry at Harvard Medical School. And we have a 6-person cross-site team, and we have site-based mental health leads. And so I want to thank all the members of our cross-site team, our site-based mental health leads, and also our psychiatry fellows who have been supporting the work at the sites and now remotely supporting that work. And as I mentioned, we've developed a learning collaborative across the sites that we've now been tailoring to the COVID situation. And again, I'm not going to get too much into the details of this, but over the past 2 years, we've been working on a cross-site collaborative in community-based mental health care for common mental disorders, depression, anxiety, stress-related conditions. So we hope to be taking advantage of what we've already done, and this visual here will show you some of the work we've already done in establishing this collaborative around psychological care. And last year, 2019 to 20, we had more than 32,000 patient visits across all of the PIH sites at 96 PIH-supported health facilities with ministries of health. And we had more than 5,700 new people starting treatment for mental health conditions. And we also, in the past 2 months, published a couple papers describing the articulation of very significant community mental health systems. In Haiti, Adolescentes developed a comprehensive, sustained community mental health system that serves 1.5 million people over the past 10 years. And in Shutimu Buzima in Rwanda has developed a very robust and elegant primary care integrated delivery system where government generalist nurses deliver pharmacologic medication treatment for severe mental health problems, as well as now psychological care. And these efforts in Haiti and Rwanda have informed practices and work at other sites, some of which has happened in West Africa, for example, in Sierra Leone and Liberia, where we've been developing community-based care. And also we have been partnering with the Ministry of Health in renovating the oldest psychiatric hospital in sub-Saharan Africa. And there's a very nice 5-minute video from author John Green describing their visit to that site. And we have a PIH mental health story map online. I'll give you the link. You'll receive the document. And that does a site-by-site overview of the work that's going on. And there's a lot of work going on in mental health. And we will continue with ongoing essential COVID-related mental health activities, including community and facility-based crisis management and referral for mental health emergencies, continued psychological first aid and basic psychological support focused on the crisis, ongoing medication management, ongoing proactive case management of the most vulnerable service users, continued psychotherapy for those with significant functional impairments, maintaining regular clinical supervision and support for non-specialist providers and community health workers performing crucial mental health service-related activities, and essentially, most essentially, food support for our most vulnerable service users. And I can't emphasize enough the importance of the food support and the social support, which often does not get bundled into our packages of care delivery. And we're always having to budget for that. To close, I just want to mention a couple ideas about how the COVID situation is going to impact global mental health delivery in the world. I think that it could bring significant change in systems of care and how they function and are financed for mental health. It'll be interesting to think about whether the contact tracer concept and community health worker delivered support for various things, whether it actually gets traction here in the United States, where we have quite fragmented and complex privatized healthcare systems that to date haven't really welcomed that innovation. Although when we think about, for example, the trend of psychiatric nurse practitioners delivering psychopharmaceuticals in the United States to cut costs around the cost of psychiatrists and more specialists, more expensive specialists, that is a task sharing function that is actually a similar phenomenon. And so it'll be interesting to see how systems of care accommodate and integrate mental health in a more functional way as a result of the COVID situation. How we address humanitarian crisis is also relevant, and then task sharing with non-specialist providers providing care for mental health related problems. So with regard to systems of care, the pyramid I showed you before for emergencies also relates to the long-term development of systems, and we really want to move towards self-care and informal community care at the bottom of this pyramid. We tend to spend money in long-stay facilities, psychiatric services in general hospitals. Those are needed, but more resources are needed for the bottom of the pyramid in all contexts, high, middle, and low-income countries. We've also been working with an organizational expert group through WHO and the Interagency Standing Committee Reference Group, and we've been collaborating around the development of advisement around continuity of care. Then I mentioned task sharing and non-specialist delivered care. This is another area that we need to keep our eyes on as we move forward with COVID. And finally, in terms of integrating care and wellness, as platforms of care delivery are ideally strengthened through COVID, it'll be very interesting to see how non-clinical wellness and dimensional approaches to care, along with digital innovations, are integrated into communities and linked to primary healthcare and general hospitals. Also interesting will be the way digital technology through the delivery of care by non-specialist health workers will be optimized, whether it's through training and skill building, supervision and support, screening, referral, and clinical decision-making, communication between patients and peer support, or data collection and monitoring. And that's the end. Thank you so much.
Thank you, Beppe. I really appreciate the conversation, and I know everyone listening, we have a couple hundred people at least who've been watching and listening, and some questions submitted already. To those folks who didn't hear the beginning of the presentation, if you do have a question, feel free to submit it at the Q&A segment at the bottom. We do have some pre-submitted questions, Beppe, so I thought we could go over to that first, if you don't mind. So Brian asked, I think, a good question that you have covered, but it would be great to just address a bit more. What are some ways to help control anxiety during these challenging times?
I think it's a great question. So I do think that very explicit effort to use self-care practices would be an important start by yourself. Then finding the right people, friends, family members to speak with about worries, concerns, and finding a way to frame that so that it's not all consuming and that there's a break from that. And then I would say if anxiety is becoming more overwhelming, definitely communicating with a primary care physician or your ongoing care providers, and considering adding in a counselor for virtual care through Zoom, for example, or other HIPAA-compliant modalities. And the treatment for anxiety starts with self-care and then counseling, education. It can include medication for more severe anxiety, and you would want to speak with a primary care physician about that. But all of the things I've touched on, self-care, peer support, family support, and then counseling and linking through primary care, and then possibly more specialized support from a psychologist, social worker, psychiatrist, other allied mental health profession would help.
That's great, thank you. And we've talked about this separately, and I found your 10 tips very helpful for myself and my family, and children. I see a next question is about some of that from Virginia. What can be done to protect the mental health of young children, especially elementary school age, during this pandemic? And for anyone else who has a question would like to add theirs, just go to the Q&A section and type that in. We'll take a look. So Becky, what would you say about children school age, in particular the elementary age range?
Yeah, well, I think that with the school situation, we're presented with a very particular challenge. And I would argue that each child really needs to be, the needs of each child needs to be factored in on a very individual basis. Because developmentally, each child is at a different stage and each child has different vulnerabilities or needs. And so you know your child best. As I mentioned earlier, as parents, we're confronted with the challenge of managing our own affect, anxiety, distress, and harriedness around managing, if we're lucky enough to be work, in addition to school. And then there's the inadequacy of the video feed and the school interface, which is not the faults of the school. It's not homeschooling. It's something else. And so I would strongly suggest really trying to develop some kind of schedule that is not too strict, that you can hold to. What I'm observing with my own kids, in particular my younger one, is the situation of us being at home with our children is strange because you're not at work or you're not out of the house. And there's a bit of a shock that you're not fully available to them. And so I'm myself am dealing with this feeling that I'm disappointing my children by not being fully available. And I think that we all have to contend with our own sense of inadequacy and really accept that there are limits to how much, we can do. There is this concept in the field of good enough parenting. Winnicott was the person who supported that idea. And I haven't heard it used yet in the concept of COVID, but it's just coming up for me now. But really, you should sit down and do a little bit of soul searching about what's good enough in this situation. And the situation will change, and we have to be hopeful about that. And then just reminding that the kids do follow our cues, and it's easy to kind of soften some of our expectations of ourselves around how we use language and how we talk about things. But all of this said, it's a very challenging situation to be a parent, particularly a single parent or an alone parent. And I have the utmost respect for those people.
Absolutely, that's great that you mentioned that as well. And we have a number of questions kind of along the same line of as a healthcare provider and someone even who might provide mental health services, how do you stay safe and also, I guess, maintain good mental health as you're juggling all these roles in your life, right? And keep yourself safe, your family safe, and have a solid grounding mentally.
In general, or for a mental health provider?
Maybe in general, because there are a good number of people who've asked about this, as a healthcare provider, how can I balance all of that?
As a healthcare provider. I attended, we have an employee assistance program that we have a contract with the Conterra group, and I've been listening to some of their webinars, which have been really good. And there was one on being a manager in this crisis. And, one of the things that I learned listening to that was that I think that there is a lot of space here, ideally, to shift your schedule in a way that works for you. And so I would encourage people, aside from all the things I've already said, to not assuming that you can't make some adjustments in the structure of your life to alleviate the burden of multitasking all the time. And I think it's this multitasking that is very concerning in terms of how it's going to burn us out. I think the multitasking is going to be the root of burnout. And this really is a marathon. We have to be ready for a longer term response and preparation and accessibility to the people who need us. So, my answer to that question is, we have to think pretty radically in how we shift our work lives for now. And I would encourage you to do that. And if work is completely on hold, I want to just emphasize in my clinical work, what I've been observing is a reasonable schedule has been so helpful for people. And this concept of resetting over the course of the day, because what's happening is that it's now a perfect storm for us to sit in front of our computers and have 5 screens open and even multitask in that way. And I think what it does is it dulls our brains. And there's also this phenomenon of the anxiety and how that's affecting our brains. And so, I think we need to find creative and active ways to shift our brains so that we're staying sharp. And then I want to reemphasize that concept of altruism and serving others. And the other piece is if you're collaborating with people on something, really being positive and encouraging and bolstering each other.
Yeah, that's really great. Beppy, I think I'm just going to take one short question, and then I'm sorry, we have to wrap it up. There's so many great questions on this topic. We could probably have an hour just of questions. But I do see several people asking about this, and I think it's pertinent. People know this is affecting in a very personal way. They either know people who are sick or have lost a loved one. What, if any, advice could you provide for people who are mourning at this time?
Well, for those of you who have lost friends and family, our condolences are with you. Proper mourning is so important, and there's a cultural aspect as well that has to be respected. And those rituals have been disrupted. One thought I've been having is that people need to take time to be sure that they find a way to mourn under these circumstances that eventually makes sense and allows for the right feeling. But it's a very complicated situation with regard to that. And my strongest suggestion is taking time to mourn in different ways, involving family and friends as much as possible, finding creative ways to do that using the technology, and also just knowing that you're not alone, that this is happening to so many people. And there hasn't yet, as a society, been a communal coming to terms with that, because we're still in the middle of it. But I'm hopeful that, as communities and as a society, we will find the right way to mourn collectively for all that has happened here in the United States. But also, mourning can be an extended process personally. We have to be careful not to sort of jump to saying that we're depressed and that there's sort of a clinical issue. I would suggest, involving people in that kind of discussion individually, personally, confidentially, as to how a person is doing. If you're alone and you've lost someone, on the one hand, it's going to take time. On the other hand, we want to prevent people from, deteriorating or, just struggling with the basics for an extended period of time. So I think that's a balance between finding the way to mourn, but to also receive care if it's needed.
That's great. Thank you, Beppy. I know that is has been a question that was repeated a couple times in our chat and questions. I want to thank you again, Beppy, for taking this time. It's really been very helpful. I know for me personally, I think for colleagues within PIH, and I think everyone who's been listening. We will be sharing this presentation. It is recorded, so we can share this link with anyone who is dialed in, and on our social media channels. Beppy will also be sharing his slides. I know some people were concerned about.
And feel free to email me. And if you have any follow-up points, please email me, and I'm happy to speak with you. And thank you very much.
Thank you, Beppy, and thanks to everyone listening. I want to encourage you to keep plugging into these webinars as we have them. There will be 3 more. Next week will be May 6th at 3 p.m. with our wonderful, fabulous, strong nursing staff. It's Nurses Week starting on May 6th. And also just check out any of the work that we're doing on social media, on Facebook, Twitter, Instagram, LinkedIn. We're there. And thank you to all the supporters. We wouldn't be able to do this work without you. And I know, speaking sincerely from everyone at PIH, we are so grateful for your support and for your attention.